and welcome to the session on First Aid Method and Basic Training. Let's begin with the session.
Let us now look at the objectives of this session. At the end of this session, you will be able to perform first aid methods to rescue an unconscious victim of different conditions. Perform treatment for stopping of bleeding. First, let us learn about the procedure to prepare the victim to receive artificial respiration. Loosen the tight clothing which may interfere with the victim's breathing. Bring the victim safely to the ground level and take necessary safety measures. Start artificial respiration immediately without delay. In general, avoid violent operations to prevent injury to the internal parts of the victim. There are various methods of artificial respiration, such as Nelson's arm or lift back pressure method, Schafer's method, mouth-to-mouth method, mouth-to-nose method, and cardiopulmonary resuscitation or CPR method. Now, let us learn about the procedure to resuscitate the victim by Nelson's arm or the lift back pressure method. Place the victim prone, that is, face down, with his arms folded with the palms one over the other and the head resting on his cheek over the palms. Kneel on one or both knees near the victim's hand. Place your hand on the victim's back beyond the line of the armpits with your fingers spread outward and downward. Thumbs just touching each other. Gently rock forward, keeping your arms straight until they are nearly vertical, and steadily pressing the victim's back as to force the air out of the victim's lungs. Synchronize the movement of rocking backwards with your hands sliding downwards along the victim's arms and grasp his upper arm just above the elbows. Continue to rock backwards. As you rock back, gently raise and pull the victim's arms towards you until you feel tension in his shoulders. To complete the cycle, lower the victim's arms and move your hands up to the initial position. When the victim revives, keep the victim warm with a blanket wrapped up with hot water bottles or warm bricks. Stimulate circulation by stroking the insides of the arms and legs towards the heart. Keep him in the lying down position and do not let him exert himself. Let's learn the do's and don'ts for performing the Nelson's arm method to resuscitate. Nelson's arm or lift back pressure method must not be used in case there are injuries to the chest and the belly. Do not give the victim any stimulant until he is fully conscious. Next, let us look into the procedure to resuscitate the victim by Schafer's method. Lay the victim on his belly, one arm extended direct forward, the other arm bent at the elbow, and with the face turned sideward and resting on the hand or forearm. Kneel with one knee on either side of the victim so that his thighs are between your knees, and keep your fingers and thumbs positioned. With the arms held straight, swing forward slowly so that the weight of your body is gradually brought to bear upon the lower ribs of the victim to force the air out of the victim's lungs. Now, swing backward, immediately removing all the pressure from the victim's body, thereby allowing the lungs to fill with air. After 2 seconds, swing forward again and repeat the cycle 12 to 15 times a minute. Continue artificial respiration till the victim begins to breathe naturally. Avoid this method in case of injuries to the victim on the chest and belly region. Next, let us learn about the procedure to resuscitate the victim by mouth-to-mouth method. First, lay the victim flat on his back and place a roll of clothing under his shoulders to ensure that his head is thrown well back. Tilt the victim's head back so that the chin points straight upward. Grasp the victim's jaw and raise it upward until the lower teeth are higher than the upper teeth. Maintain the jaw position throughout the artificial respiration to prevent the tongue from blocking the air passage. Take a deep breath and place your mouth over the victim's mouth, making airtight contact. Pinch the victim's nose shut with the thumb and forefinger. If you dislike direct contact, place a porous cloth between your mouth and the victim's. For an infant, place your mouth over his mouth and nose. Blow into the victim's mouth until his chest rises. In the case of an infant, handle gently. Remove your mouth and release the hold on the nose to let him exhale, turning your head to hear the rushing out of air. The first 8 to 10 breathings should be as rapid as the victim responds. Thereafter, the rate should be slowed to about 12 times a minute, 20 times for an infant. Let us learn about the do's and don'ts while performing this procedure. If air cannot be blown in, check the position of the victim's head and jaw and recheck the mouth for obstructions. Then try again more forcefully. If the chest still does not rise, turn the victim's face down and strike his back sharply to dislodge obstructions. Sometimes air enters the victim's stomach as evidenced by a swelling stomach. Expel the air by gently pressing the stomach during the exhalation period. Now, let us learn about the procedure to resuscitate the victim by mouth-to-nose method. Use the fingers of one hand to keep the victim's lips firmly shut. Seal your lips around the victim's nostrils and breathe into him. Check to see if the victim's chest is rising and falling. Repeat this exercise at the rate of 10 to 15 times per minute till the victim responds. Continue this exercise till the arrival of the doctor. Use this method when the victim's mouth will not open or has a blockage. Next, let us learn about the procedure to resuscitate a victim who is under cardiac arrest by CPR or cardiopulmonary resuscitation. Check quickly whether the victim is under cardiac arrest by checking for the absence of the cardiac pulse in the neck, blue color around the lips, and widely dilated pupils of the eyes. If the heart has stopped, act immediately. Lay the victim on his back on a firm surface. Kneel alongside the victim, facing the chest, and locate the lower part of the breastbone. Place the palm of one hand on the center of the lower part of the breastbone, keeping your fingers off the ribs. Cover the palm with your other hand and lock your fingers together. Keep your arms straight. Press sharply down on the lower part of the breastbone, then release the pressure. Repeat the previous step 15 times at the rate of at least 1 per second. Check the cardiac pulse. Move back to the victim's mouth to give 2 breaths, that is, mouth-to-mouth resuscitation. Continue with another 15 compressions of the heart, followed by a further 2 breaths of mouth-to-mouth resuscitation, and check the pulse at frequent intervals. As soon as the heartbeat returns, stop the compressions immediately, but continue with mouth-to-mouth resuscitation until natural breathing is fully restored. Place the victim in the recovery position. Keep him warm and get medical help quickly. Next, let us learn about the procedure to treat a bleeding victim. Determine the location of the bleeding. Elevate the injured area above the heart if possible. Apply direct pressure to the bleeding area with sterile cloth. Keep the pressure on for 5 seconds. Check to see if the bleeding has stopped. If not, apply further pressure for 15 minutes. Clean the wound. Bandage the wound with pad of soft material. Advise the victim to take medical treatment.
To recap, we have learned to perform first aid methods to rescue an unconscious victim of different condition. Perform treatment for stopping of bleeding. So that was all about first aid methods and basic training. Hope you have understood all the concepts. See you in the next session.